1 second.
Testing. Can you hear me, Congressman?
Yes, sir.
Congressman, my name is Dr. Zan Tyson. I'm a cardiologist here. I practice cardiology in these parts for about 20 years now. I represent a group of 20 cardiologists at Carolina Regional Heart Center. Our service area here is about 400,000 people. We provide cardiology to them, and last year we saw 34,000 patients in our office last year. 70% of those patients are Medicare patients. Cardiology is an old person's illness, and most folks that come to see us are Medicare age. On January the 1st, as part of the SGR formula, we received a 36% reduction in reimbursement for a large number of the procedures that we do. An additional number of the procedures were cut by 10% on top of the 10% last year. We're scrambling, getting ready to cut services, perhaps physicians to leave the practice. And so I have a message for you. That message would be that it won't do much good to provide people with health insurance if there are no doctors there to provide it for them.
Y'all got to give me equal applause there. No, please don't take up time with applauding. On either side, really. I mean, I appreciate what you're doing, but we want to try to get as much of this in as we can.
And you're correct. The bill is done. I'm not here to argue with you about that. All I want to do is communicate as a healthcare professional. We're here to serve our patients. Any business can't sustain a 25% reduction in revenue in one day. And this SGR thing that has gone on for year after year after year, when I try to run my business and look to plan for the next year, and then it comes up right to the end of the year, you can't run a business that way. So I'd like to hear you address, what does the government plan to do? Is it in this bill anywhere where physicians, how we are paid and how we can continue to supply the services that people have come to know and expect of us? How can we do that in the face of this sort of cutting? And we didn't hear, I didn't hear anything about this in any of this discussion.
Well, in fairness though, you say your reimbursement rates were cut. They actually were not cut, because we kicked it. No, we passed a bill to extend the...
Congressman, you're talking about the 21%. I'm talking about the 36% reduction in stress nuclear testing that we do to be sure that our patients don't develop coronary disease, and the 10% reduction in echocardiogram. I'm not talking about the additional 21%.
Okay, all right. The 21%, I'm not sure that I'm not sure what we're going to do about the two things that you're talking about, but the 20%, we have extended the drop off the cliff there, and I have every reason to think that we will continue to extend it until we find a permanent solution to it. But I'm not familiar with the two specific things that you're talking about. I'll be happy to research, but there's nothing about either of those things in this bill. The bill was to extend just to 21% will be a substantial cost, right? Somebody's got to pay for it, and the decision was made, we need to deal with that in a separate setting, try to find the pay-fors, the money to pay for that in a separate setting. But in the meantime, we did extend the period of time that the reimbursement rates. Just as an aside, you'll be happy to know, maybe you won't be as happy to know, but I tell you, the anesthesiologists and people who are required to show up in emergency rooms and deal with these things in an emergency situation as opposed to under Medicare will be extremely pleased that we have in this bill increase the Medicaid reimbursement rates for primary care physicians to match the Medicare reimbursement rates. That was something, you talk about people walking away from the profession. They weren't walking away from the profession, they were just saying, we're not going to see any Medicaid patients because we can't afford to do it based on what you all are paying us to see these patients. And we've tried to at least take the first steps toward remedying that situation in this bill.
Thank you for answering my question.
And